2020 candidate Tulsi Gabbard, who rose to prominence after dropping out of the DNC in 2016 and endorsing Bernie Sanders, has appeared to abandon Medicare-For-All. Now, before I even get to this new clip, which is from an interview that Gabbard had yesterday with NPR, I could have done a video on this a couple months ago, because after the second debate where Tulsi Gabbard correctly knocked Kamala Harris, after that debate, she spoke to Anderson Cooper and said this about healthcare.
Do you think for those who are embracing taking away private insurance from people, ultimately, is that just strategically, politically, a non-starter?
I don't know about the politics of it. I just think about it from the perspective of people, of the American people, that if all of a sudden you are taking away their choice, that's not a very American thing, in my opinion. I think our responsibility as leaders is to meet the challenge and address the problems that people are facing, that they are suffering because of big insurance and big pharma's influence over our healthcare system for so long, how they are profiting on the backs of sick people. So let's do our job, try to bring down the cost of healthcare in this country that's exorbitant, make sure people can get the quality care they need, and if they still choose that that's not what they want, they can go get the private insurance.
I asked Kamala.
So there you go. That was 2 months ago, and you could almost forgive her comment about choice earlier in the clip until she gets to her last comment, where she says if they still decide that's not what they want, they can go get the private insurance. This is a public option. This is not Medicare for all. And in case there's any confusion, here's what Tulsi said to NPR during an interview yesterday.
When you say healthcare, are you for Medicare for all? If you can just tick through the list more specifically.
Yes, I prefer to call it Medicare Choice, where we are ensuring quality health care for all people, regardless of how little they may have in their pocket or their bank account, while maintaining their freedom of choice. If they've got an employer-sponsored plan or a union-sponsored plan that they're happy with, they should have the opportunity to do so. But the bottom line being that in the wealthiest nation in the world, there is no excuse that we still have far too many Americans who are underinsured or uninsured and who are one healthcare emergency away from total financial disaster.
Yeah.
There you go. What Tulsi Gabbard describes there is a public option. That's not Medicare for all. Let me just read through her answer again in case there's any confusion. Yes, I support, pauses, I prefer to call it Medicare Choice, where we are ensuring quality health care for all people regardless of how little they may have in their pocket or their bank account, while maintaining their freedom of choice. If they've got an employer-sponsored plan or a union-sponsored plan that they're happy with, they should have the opportunity to do so. That's a public option. That's not Medicare for all. So this would split doctors among insurance companies. It would neuter Medicare for all coverage because people would no longer be paying into the same pool. All taxpayers wouldn't be paying into the same pool. It splits coverage. It costs taxpayers more. And if you don't believe me, here is a piece from George Baumfalk. He's a retired neurosurgeon and chairs the Education Committee of Healthcare Justice, North Carolina. Here's what he said about a public option. A public option cannot save that $500 billion, nor can it reduce the healthcare costs. It will only add one more choice of insurance provider to the current complex mix. Most of us neither know nor care which company provides our insurance. The choice we really care is choice of doctors and hospitals. Most private insurers restrict that choice to maximize profits. They also restrict our access to healthcare by imposing deductibles and copays, which many of us can't afford. Medicare for All offers free choice of doctors and hospitals with no deductibles and copays. What more choice can anyone want? The other fatal flaw in a public option is that it will likely become the insurer of last resort to the sickest and oldest among us. The insurance playing field will be anything but level. As deficient as they are, for-profit insurers will cleverly market themselves to the young and healthy, leaving those who use more health care to the public option. Its costs will balloon, dooming it to fail to the delight of for-profit companies. Now, what I found really interesting was if you go to her old congressional website, it actually says there that she supports Medicare for all or a public option. So she was right out in the open with it years ago. That's what she supported publicly on her website. Even though she talked about supporting Medicare for all, it said on her site the entire time that she also supported a public option. When it comes to healthcare, you can't take this approach. It's all or nothing. It's Medicare for all. There is a reason why Bernie Sanders is unwavering on this issue. He understands how the healthcare system works. He understands how everybody needs to be on the same plan, on a single payer plan, everybody paying into it, which means your politicians on the same plan, the wealthiest people in the country on the same plan, everybody on the same plan. You take out the for-profit interests and you are guaranteeing everybody quality healthcare. Tulsi Gabbard does not support that. Now, I'm seeing people online, because I put this news out there on Twitter. There are some people out there that appear to be unwilling to accept this information. Some of them will say, well, Tulsi Gabbard supported the Medicare for All bill in the House, so clearly she supports Medicare for All. But that's like saying Kamala Harris co-sponsored Bernie Sanders' Medicare for All bill in the Senate. Does that mean Kamala Harris supports Medicare for All now? No. Much like Kamala Harris, Tulsi Gabbard has abandoned Medicare for All. It's obvious. Now, the other question here is why? Because as far as we know, Tulsi Gabbard isn't taking money from insurance companies. So why would she make this move? Well, here's the reality. Tulsi Gabbard hasn't broken 5% in the polls. She's also been defending Joe Biden, or at least avoiding going after Joe Biden. There's two reasons right there for why Tulsi Gabbard may be making a change in strategy. Her campaign isn't working out, and she is protecting Joe Biden potentially for the idea that she may get a position in his cabinet if he were to win. I mean, what else is there here? She is prioritizing her political career over people. Somebody that is dedicated to guaranteeing people health care, that is dedicated to Medicare for All and actually understands the healthcare system and how it operates, would not be wavering on this issue. There is no reason for Tulsi Gabbard to take this approach except for her political career. She sees it as another way to get ahead because the way she's going right now isn't working. So just understand who Tulsi Gabbard is. Look, again, this is not somebody that I see as a threat. She's not doing too well right now in the race. But I just want her supporters to understand, if you support Tulsi Gabbard over Bernie Sanders, what are you doing? You have somebody in Bernie Sanders who has been unwavering on every single position for the past 40 years. He is somebody that has proven that he will fight for you. Tulsi Gabbard is back and forth on a number of issues. And when it comes to Medicare for All now, I mean, this is just another one. And maybe the most glaring move that she has made in terms of her wavering on a progressive issue. I don't understand how anybody that, consider themselves to be on the left or supporting progressive policy or supporting left-wing policy. I don't understand how anybody could still support Tulsi Gabbard over Bernie Sanders.